My name is Yvonne Coghill and I am the Senior Programme Lead for Inclusion and Coaching in the Leadership Academy.
My name is Dave Ashton and I'm the Head of Practice here at the Leadership Academy.
Inclusion, equality, diversity, fairness, agenda, call it what you like, is complex. And I think that people imagine that's an easy tick box thing. So we'll do inclusion and tick the box and then everything will be okay.
We've not worked together long. We went to the same meeting, so I'm not naming names, but someone's saying to me, whatever you do, it won't be right. It will be wrong. You will make a change here, you'll put something in place there, and it'll be fine for one group and it won't be okay for another group. That is difficult, and I've seen that as well in practice. So if I watch a TV programme, I'm now constantly looking, how diverse is the mix of people here? How obvious is the difference in the room? And just how hard it is just being other. Apparently there's a trendy term at the minute called Otherness, and how Otherness is represented. And being a white, middle-aged guy, I have it easier, much easier in many ways.
Your point is absolutely right and well made, because I don't think people recognise or realise that some people, just by being born white, middle class, it affords you a certain amount of entitlement and privilege that other groups don't get. I've learned to become more understanding of people coming from a different place to me, because I used to believe, why couldn't they see it? Why can't people see that difference is important? And why don't these white people get their act together and start behaving differently? Well, why would they? If you are coming from a place where you were born, where there's mostly white people, you've been to school with mostly white people, you've just gone up through the ranks and there's been no issues for you, you haven't had the experience of the difficulties that some groups have. So then what we start to ask people to do is to think about being empathetic and understanding. And for them, it's kind of like, well, why? Why would I? But I think for us in health, it's important that people grasp that and grasp the things that you've grasped around difference and how people are coming from different places. Subsequently, they need different interventions. Because in order to make our society fair, we have to do different things for different groups of people.
You've talked to me about weathering for folks from a BME background, and it's just harder day on day, kind of living your life because you have to put on your armour.
You're absolutely right, and it is wearing. And I think the weathering thing, which was something that I found out about recently when I went over to America and met the wonderful Dr. David Williams. And the work was done by this woman called Arlene Geronimus. She did a lot of work on women in America who were just ordinary women, black and white, having babies. And what she found was, regardless, and I thought this was absolutely fascinating, regardless of whether they were middle-class black women or working-class white women, the middle-class black women were more likely to lose their babies than working-class. Because in our heads we think that the more prosperous you are, the more educated you are, the better life will be for you, is what we automatically think that. But what she was finding was that wasn't the case at all. And the most educated black woman still was more likely to actually have her baby die than a white woman who was not educated and came from a very poor background. And what she did was she actually looked at what they called all the factors that could possibly or potentially make that difference. And taking them all to one side, the only difference was race. That was the only difference. So she looked into it a little bit more to find out exactly what was going on. And what she found was that women from black and minority ethnic backgrounds, and particularly ones going up the ladder, had to do the thing that you said, which is to put your armour on every time you go out. So age wasn't only capturing the length of time they were alive, it was capturing the experiences they'd had within that time. And if those experiences were difficult and hard, and they had to take a deep breath to go into rooms where there's only sort of middle-class white men, or you can't go to the pub at lunchtime because you don't know how people are going to treat you, or you believe that your children are going out to school and you have to worry about the fact that they might be shot or picked up by the police or frisked or whatever it is. Those experiences are causing you increased stress, and that increased stress weathers your body physically and mentally. So you're more likely as a black person to have mental health problems. You're more likely to get diabetes and coronary heart disease. You're more likely to die sooner than the white person. And on top of all of that, if you have to deal with then the likelihood that you're less likely to get a job, you're less likely to actually be sent on training and development programs, you're less likely over your lifetime to earn as an amount of money that the white person would. Put that on top of all the other experiences that I've just described, you can see where this weathering thing comes from and how it is that it impacts on people's health. So when we talk about health inequalities, we're talking about, usually in the NHS, we're talking about people out there. We're talking about, the communities. What we tend not to do is recognise that the members of our staff come from those communities and are living within those communities. So the weathering that's happening out there for them is actually happening for those members of staff, and we have 18% of our 1.4 million workforce from black and minority ethnic backgrounds. It's happening to them as well.
There's another bit of work by another American, Ali Hochschild, and she wrote a book back in the 80s, I think it was. After that, I'll look it up again. The book's called The Managed Heart, and that's all about the emotional impact or the emotional cost of working in an emotional setting. Yeah. So her study group were, I think there were airline staff and also people that worked on the shop front, that they were paid to put on a smile and be polite when actually they were struggling inside. And it's a paid task, and so even more so when it's working with sentient beings. So if you're in healthcare, if you're struggling in life and you're getting more knockbacks and you're being asked to look after people, and that's part of your job, to give good care, there's a cost. And there's a cost for staff and there's a cost for people that receive care. And it's how we pay attention to that through, I guess, our leaders being aware of the dynamics that are out there. And I think that's part of the Academy's role, is bringing that awareness powerfully and skillfully into the programmes that we deliver. Because if the leaders don't get that, don't get this as an important aspect of day-to-day life, not only at work, it's societal, you mentioned already, it's a societal thing as well, then we're losing out, and patient care won't be as good as it could be.
I think that is absolutely right, and I think for us in the Leadership Academy, it's all about healthcare and having leaders that can deliver that healthcare and understanding some of the things that you and I have talked about here this morning. So, for example, understanding and knowing that the link between an engaged workforce, some of the work that Mike West has shared with us and Jeremy Dawson, understanding that having an engaged workforce, people that really want to go to work, that feel motivated, that feel part of something, gives them a little bit of a lift. So when they're working with patients, the patients feel that. There's an emotional connection. So as a nurse or a doctor, you're more willing to go the extra mile because you're cared for. You care more. Yeah,
it's this notion of emotional contagion. So if I rock up to work and I'm not feeling good, however hard I try, that will infect other people, affect other colleagues and patients and carers. It spreads.
I think so, and I think it's a real health issue. It's a societal issue. It's a human issue that we're dealing with here, and that's the complexity of the thing. And so the fact that you understand and get that, so the work that we are doing, supporting our senior leaders to get that, so that's putting some grit in the oyster. And actually some of the things that we've been doing, the videos we've been showing people, the discussions we've been having, have actually shocked a few people because it hasn't been part of their consciousness. But what do? They immediately switch onto it and say, well, yeah, I haven't been paying attention to this. I need to pay attention to it. So one example was one of the people from Top Leaders actually left the room and went and made a phone call to find out exactly what was going on in their organisation around inclusion. Another one said that when they went back to their organisation, they actually stopped and asked some people in the corridor, how does it feel for you to work here? Their consciousness was switched on by understanding that this is something that they need to do something about. but sometimes people just don't know what to do or how to go about doing it, or they don't have the background understanding.
Yeah, I think that's it's a key point. It's how you create conditions that are kind of safe enough for people to have honest conversations. That I don't know what it's like to be disabled. I don't know the challenges someone might face, and sometimes to inquire into that, I've caught myself, even though I'm a nurse by background, it's different when I've kind of had a nurse's uniform doing that compared to when I've been in a leadership role or a formal leadership managerial role. It's a different set of skills bringing it into the conversation. And sometimes it feels really clunky, but not to do it, it's not right not to do it, but people need the skills. And as I say, they need help in feeling safe enough to have some of those conversations. Some of the conversations we've had about what it's like for you as a black woman, I wouldn't have with many people. And we need time to have those conversations. It's not something you can do just in an odd 5 minutes here and there. You need to sit down with people and talk about what it's like. What is it like in your world?
That brings me sort of full circle to the leadership issue, really, and having leaders like you from white to middle class backgrounds who are switched on to the agenda, who are willing to say, I don't know, help me, let's work on this together, so that we can have a workforce, a senior leadership workforce that does get it and does understand it, because ultimately it will be beneficial to our patients, but also it will be beneficial to all of our staff. In doing that, as one of the biggest organisations in the world, we have a responsibility to do this right and to do it well for all of our staff, but more than that, for our patients. And in an increasingly diverse, UK, Britain, it's something that we have to really pay attention to, and we haven't in the past. So we need to think about, we've got people from different parts of the world living here, we have people from different parts of the world actually, being sick here. How are we going to make sure that they get what they need, what they deserve, the service that they need and deserve from our health service? And that is through leaders understanding their needs and designing and developing services for their needs, but using their workforce in a way that's appropriate and right, so their workforce feels engaged, motivated, switched on, and part of what's going on for their patients. So it's an iterative circle. So we start with, in the academy, senior leaders, and trying to get our senior leaders to understand the thing that we understand, which is that this isn't about beating people up or saying you're not doing this and you have to do that. It's about ensuring that everybody, as part of our constitution, gets high quality patient care when they enter our services, regardless of their background and regardless of where they've come from in life.